We've got your back. Hey, Dr. Herrick, back here with part 3 of strains versus sprains. Hard to say who's winning. So just a quick reminder, looking at our little shoulder model here, white fibers, ligament, tendon. Red fibers, muscle. White fibers, no contracting. They can't contract, they can't get bigger or smaller. They're just there, supporting tissue. Red fibers, the whole point is that they can contract and relax, contract and relax. So strains happen to red fibers as they're contracting and relaxing. You get tears and fissures on those fibers, making it difficult to have pain while you use it, okay? Whereas sprains, the tissues go every which way. They go three-dimensionally, they're all intertwined, there's no contracting element, and when they get torn, they get full of fluids and swelling exudates. That's a fancy word for swelling. So you get all this exudate and swelling materials building up in here. It's hot and it's puffy. What does it really want? Okay, well, today we're going to talk about the difference between how do you tell the difference and what do you do differently for each one. Because there's a couple of crucial elements that will help you take 2-month healing time and reduce it down to about 2 weeks. So if you have, it's important to recognize that there's a continuum. Meaning that I go and I exercise, I work hard in the backyard, I'm digging holes or shoveling, gardening, whatever, and I get a sore back the next day. Some of that may be muscle and be a strain, and some of that actually might be ligament and be a sprain. And the two go over top of each other. The key difference is noted when you have a sprain, that tends to hurt all the time. And it tends to hurt all the time, plus when you have movement. Whereas a strain, which is the muscle fibers, tend to hurt when you use the muscle. So you go to use the muscle and that's when you feel it. The best example we've all experienced is you go to the gym or you go on a long walk, you do something a little out of your norm, and the next day the muscles you used on that thing you did are just a little sore to use. You've all experienced that. But here's the difference. Muscles are big, contracting tissues. Ligaments and tendons are smaller, more wrapped around the joints, adhering tissues. What muscles and ligaments do, how they respond, and how they have a different application of compression, rest, and ice dictates the difference between a 2-month and a 2-week healing time. So for a ligament, what you want is you want to support the ligament. The ligament stabilizes the joint. Doesn't matter if it's your ankle or your shoulder or your elbow, but you want a tight compression on it because you're trying to compress the very things that support the joint, the very tissue that holds the joint together. You're trying to mimic that with the brace. So you want heavy compression to the point where it cuts off circulation, particularly for the first 48 hours. Don't make your hand turn blue or your foot turn blue. Loosen it up to the point where it's still getting blood, but that's just an idea of how hard or how compressed that tissue should be. Whereas what helps a muscle heal in a strain situation is the muscle needs a little bit of compression to keep the swelling down, but it needs enough ability to move. So if you can move it, you want to wrap it, keep it warm, keep it cozy, make you feel at home, tell it it's going to be okay, and it's going to heal fine. And generally speaking, strains heal up within about 2 weeks. Whereas sprains, if you do the ice and the compression, you can get them to reduce down to 2 weeks to 3 weeks. If you don't, you're looking at 8 to 10 weeks of weakness in that joint. At any point in time, you want to get the joint evaluated properly by a professional, Smith Chiropractic. That's what we do all day. We live for it. I'll see you in the next video. Peace and love.